Hello, hi guys, Sbu Ndengese here, Connekt Media podcast, Botshilu Private Hospital. Today, we kopana le Dr. K. Debeila, ophthalmologist. Today, we bolela ka glaucoma. Ga ba lo renya go itse glaucoma ke eng? Relax. If you go to pathologist, e etsa eng? Relax. Nna le wena a re tsena ka mohare re khona re utlwe hore go etsagala. We here to learn and inform you. A re dumbeleng man. Hello, hi guys, Sbu Ndengese here from Connekt Media. This is yet another beautiful day mo ilong gore Botshilu Private Hospital. Today re tsere topic e massive too much. Re na le doctor ilong gore ke ophthalmologist, am I right?
Correct.
All right, Dr. K. Debeila. Am I right again?
Yes.
Hape Dr. Witsi akenya ke go bitsa anything wrong ka re la thulana le flopo ka nsuwa yong. O kra go patela tšhelete le ngora ke na yona. Doctor, how are you?
I'm good and you, Sbu?
No, not the doctor man. How is your day so far?
Well, no issues. We're here.
Ka bona wa lower doctor. Ka bona o happy man. Huh?
Life is a blessing. Every day it's a blessing. We wake up, put on a smile, and continue. Yeah.
All right, Doctor. Let's not waste time. But before tsena ka mohara topic e leng re tlobolela ka yona today, Doctor Ophthalmologist, you know, eye surgeon, right? Why this profession, Doctor? I mean, you know, go overseas ka netball or tsona le bo casta semi like it lots of bites gore ngi dikhetile mo life. But why did you choose this profession?
Firstly, I was never good at any sport.
You?
Yes. I tried board games, but still I was not fast enough to play in games.
Yeah.
Yes. But if you have to ask me why I became an ophthalmologist, my love for ophthalmology started when I was young.
Okay.
Still in high school, definitely. Because I also had eye problems. I had an allergic eye disease when I was young. And everybody would tell my parents, why don't you get your child spectacles? Why don't you get your child spectacles? I said, I told my parents I don't want spectacles. So they were in like, stuck. What are we going to do with these kids? And then they found out there's an ophthalmologist. There's a doctor called an ophthalmologist, Dr. Hervier. Now he is retired. So that was my ophthalmologist. And then I went to this doctor and he saw me and then he prescribed medication and it's like, no, you don't need spectacles. That was the best news for me. That's my first discovery that there's an eye doctor that doesn't use spectacles. And then I researched more about it. Unfortunately, I knew you had to become a doctor first, to do medicine first, the whole MBCHB, and go through the internship and community service before I can embark onto the career of ophthalmology. But I can tell you it's a very rewarding career because you see a person who is blind today and the following day they are screaming in joy, they are happy because they can see. So it's really a career of gratitude where you help somebody and you see the effects immediately and on something that really impact on their lives, the vision. And I know a lot of people would say, I'd rather lose anything else except my eyesight.
Yes.
So it's a very interesting, a very sensitive, but very beautiful career. And I love it.
It's Dr. Karata Genia how from kwa ithomileng ho fitla kgotsa o feletsa mo ilong gore feleditse on eye surgeon. Now this is what I want to say to our viewers. Wa bona ho ka kry accident maybe o wele ko sekolong or maybe ke accident ka koloi wa roe halodo. Wa kry maybe no tswana le bo casta semenya. This is what you can do. O ka tsia phone ha wa nna fatshe wa Google wa checka hore di crashes ba di etsa ko kae wa etsa a ke re tla botsa maka tsona wa meka sure le na wa di etsa wa khona re wetsa za or bjang doctor. So basically condition e long hore o bile mo yona e feleditse you pushetsa gore o feletse ba mo leng gore mo teng today.
Yes.
So you get what I'm saying?
Okay.
So now, Doctor, because I know Lonadi Doctor Levergisa Mafukama heavy, I mean ophthalmologist and in short term scheme.
It's an eye surgeon.
Eye surgeon.
Yes.
Now, Dr. Arboteman, matata matlo because I know and the experience is matata matlo. You know, ki malwetse a mabeyang a ilong hore a khosa hore felletse o ba le bothata ba matlo.
So when we talk about eye conditions, so we need to speak of an eye as an organ.
Yeah.
So if we look at an eye, so there's firstly the eyelids, which we blink and we put those lovely lashes on, and all the way to the back of the eye, to the nerve. Anything that can affect that part of any portion of the eye is what we deal with. And anything that happens at any point from the eyelid all the way to the back to the nerve can affect your eyesight. So it's easy for usually when people look at an eye, they see just one unit. But it's just like your hand. On your hand, the hand has a skin.
Yeah.
It's got muscle inside. It's got nerves. It's got bones. So it's the same thing with the eye.
Yeah.
The eye is covered by the eyelid. On its own, the eye has a skin, the conjunctiva. And then on the eye, the conjunctiva.
Doctor, English is simple.
It's the covering of the eyeball.
Oh,
so it's like a skin of the eyeball.
Oh, okay.
It just doesn't have those characters of the skin outside, like hair and keratin outside.
Yeah.
And the ball, the shell of the ball itself, the white that you see as the white part of the eye, the sclera. And then the front part of the eye, where you see there's a windscreen there, the cornea. And then the brown part, which makes us have brown eyes. Some people have green eyes. Some people have blue eyes. Is the iris with a hole in the center of that hole. We call it a pupil. Behind there, the lens, which is usually the reason why we see most of our patients with having a cataract. When the lens starts losing its transparency, it becomes a cataract. Then at the back, we've got the retina and the nerves of the eye. And all these things are responsible for your eyesight. At any point, any of these things can be affected one way or another. They will definitely end up affecting your vision.
Okay. Now, Doctor, let's talk about women. Ne? I know but I know most women what do you call these things?
The contact lenses or the lashes?
No.
The mascara.
Yeah, the mascara bathala le modima matlo. Adi anke di affect matlo in a way.
So what we advise on using mascara is that I'm not going to say women should not put on mascara, although I can put it. I'm scared of a mascara.
Okay, yeah.
Yes. But what we advise women is that make sure that your mascara is up to date. If you look at all the cosmetic products, there is a small sign there with it's a container sign with a lid, and then it's written 3M, 6M. So it's telling you how long you're supposed to use your cosmetic product.
Yeah.
And we recommend that you renew or you purchase a new mascara every 3 months.
Okay.
Yes. And you wash off your face quite well and clear your eyelash area now and again. And also on that, we also advise that if you get an allergic to a specific product, change it. So the common conditions that can happen with in relation to the mascara is some people have allergy to specific products.
Yes.
Just like with soap, you find a person is allergic to the soap and not that one.
Yeah.
So it's the same thing with the mascara. Some people can have allergy to the mascara. And the second one is that when you're using the mascara, you actually clamping the lashes together.
Yeah.
And also the pigment also goes onto that line where that lid line. That's where oil that is needed for the tears is produced.
Yes.
So it can also you can have inflammation there, and also that leads to a dry eye problem. And it can sound like it's a small problem, like dry skin. If you get a dry skin, it just get itchy. But when it comes to eyes, when they get dry, now it affects the way how the light is transmitted and how you see. So in the long run, you can actually even have blurred vision symptoms from just having a dry eyes. And sometimes if you don't clear your mascara quite well, it can even go and sit inside the fornix, which is the pocket underneath the eyelid. And then it's like you'll have a tattoo there from just the mascara. Yes.
Okay, and earlier you mentioned geofeta fela, the eye contacts. Di kenywa elo hore ke doctor o itseng o di fake or anyone o di dumbetsa fela ha filo di dumbetsa.
Okay, so contact lenses can be used for sight reasons, and also can be used for cosmetic reasons.
Okay.
Yes, and also for treatment reasons as well. Yes. So for treatment reasons, just like, we call them bandage contact lenses. Just like when you've got a wound or you've got anything that needs to be bandaged on your skin, we use bandage there. But on the eye, we use a contact lens as a bandage. So they're so-called bandage contact lenses. Then the second one is to see.
Yeah.
Because it's an option between, some people, they decide, I don't want to use spectacles, I rather use contact lenses because I don't want to be taking contact spectacles on and off. I'd rather have contact lenses. But there's incidences where your optometrist will actually advise you to use contact lenses. And that is actually the only treatment that will help. Like in patients that have a condition that we call keratoconus, it gets to a point where they cannot see at all with spectacles, and we actually need the contact lens, what we call a hard contact lens, to actually press on the cornea to help it to change the shape and see. And the last one, of course, is for cosmetic reasons, that people want to change the color of their eye. Like, there's people with brown eye, blue eyes, green eyes. People decide, I don't want to be brown eye, I'd rather be green eye today. Yes.
Hey, doctor, ke na norke flober thulanang le ona as human beings, gore hence o bua yana something se le mo tlhaloganyong yaka net fela ke nya gore banna or basadi, but hanchi we know gore e ka dumbela ko kae. Mo eleng gore pila nke o khonala gore motho a le ntse litlo a ke ntse le na le nyakang motho na ke yetsa ntho yo. Am I right?
Okay.
I mean, re boela mo yona taba di contact lenses, o mong o na le matlho ma brown, o feel gore no man ke nyaka ba ma black, so basically nke le ro khonala gore a le dumbulelo lo tleletlele na tlo na ka lens, so now we know gore batho ba bua dilo tse dintsi, and the myth ke tse dintsi tse leng gore di kry mo tseleng. Ke dilo tse feng tse leng gore batho ba bantši ba di bolela, maybe when it comes to the condition tsa matlo tse leng gore ke di myth, maybe motho a bolela gore no condition ya o khositse ke eng, or if you do this e ka etsa gore se tlhole o bona dilonyana tse bjao.
Okay, the funny one that is quite common is that people fear going for eye surgery, and the reason for that is, I'm sure you've also heard this one, it's that if you go there in there for your eye surgery, they're gonna take out your eye and put a cat eye in your eye. You've heard it, right?
Yeah. What about something man?
Yes. That's the first one. Or they say that if they break your eye, or if they can't put it back, they put a cat eye on you. And also, like the stories that we used to hear also when we were young is that there's a surgeon that went and was operating on somebody's eye. And the surgeon left the eye and went for lunch, and then the cat ate the eye. The cat ate the eye, so they took the cat and then took the cat's eye and put it on the person. Okay, so but just to clear that myth, it's that I know it doesn't make sense for a lot of people that how do we work inside the eye without taking it out and putting it there. But we do work with the microscope looking into your eye. There's instruments that help facilitate us to expose your eye. We look at your eye and we work on your eye right there. Even if we have to work at the back of your eye, we work on your eye in place. We don't take your eye out when you do an eye surgery. And another one in relation to eye surgery, it's that people will be like, you said you went for an eye surgery, but we don't see a scar. You're not going to see the scar because the scar, we see it under the microscope, because ophthalmology is actually microsurgery. It's the surgery that we do under the microscope.
Okay.
Yes. You have to be willing to work under the microscope if you want to be an eye surgeon, because when we see patients, we see you under the microscope. Like you were saying, oh, doctor must not look at my eyes because he's going to start seeing that I've got things in my eyes. So even people will be asking on the street, doctor, what do you see in my eyes? I'm like, it doesn't matter. I don't see anything. I need you to be on the machine, then I can see you. So don't ask doctors on the ophthalmologist on the street and say, can you see this thing in my eye? Can you look at it? Can you see it? We don't see anything.
So Dr. Serious, like if you look at me maybe if you can see even a little thing in J.
If it's a squint, yes, we'll see. There's gross things that we can see, but like for full assessment, you need to sit on a slit lamp, and then we check you. When we operate as well, it's under the microscope.
Okay,
so guys, do you want to go to another? Do you want to discuss the other myths that you hear about eyes?
No, doctor. If you have it, please share with us. We want to know so that we help them. You know.
Yes. And the second one, it's the one of that, like I said earlier, that an eye it's like your hand.
Yes.
So you cannot just say that it's a hand, it's got a problem, then there's one solution. There's a solution for the skin of the hand, there's a solution for the vessels of the hand, there's a solution for the bones of the hand. So it's the same thing with eyes. There's so many things that needs to be treated and that needs to be attended to an eye. So some people would say, oh, I went to an eye doctor, then they're gonna operate me. So it's not all conditions that needs operation, and it's not all conditions that needs medication. So it's per condition. Hence the 4 years to do the whole course again. To study the whole, just an eye. It wasn't just a waste of time, just for whole 4 years to study a small eye. And we come across this quite a lot with our elderlies in terms of differentiating between glaucoma and cataract.
Yes.
Everybody would say, I want to be operated. But we like say, no, you've got glaucoma, your condition doesn't need to be operated. And it's like, you're the bad doctor. Because you don't want to help me. So people need to understand that there is different eye conditions and there's different treatments for different conditions of the eye.
Okay, doctor, let me just remind them quickly. So guys, if Ludwa noise, Ludwa the footsteps, Botshilu Private Hospital, so obviously, who busy the patient, they get the rinchi, baban tons by operatiwa, you know, baban tons by lukisiwa matla, balance we pila. So now, doctor, I want to understand this one, you know. I get to her ka English, but ke tlo be pilo ro itlhalohanye.
Okay.
O kere o mong matlo ale skilibogos. And o tsetsule yona ntweo. So ho tloha ho etsahetseng mo?
So a squint is a well-recognized eye condition.
Yeah.
So it can happen in any direction that the eye can move. So you can have a squint of an eye that is turned inward, or you can have a squint of an eye that is turned outward. Some the squint, the eye is turned up, some it's turned down. And yes, you mentioned that people are born with it.
Yes.
Yes, that is one of the reasons why people have a squint. It's that they have it from actually childhood.
Okay.
It's not actually easy or realistic to say that somebody is born with a squint. It was actually seen when they are young, because when a newborn is closing their eyes, we cannot assess their vision. It's only when they start trying to look that they have what? An alignment problem. Yes. So the reason why, let's start from explaining things from the basic and say, why do you have two eyes but you don't see two objects?
Okay.
Yes. It's because the brain takes the image from your one eye, from your right eye, and the image from your left eye. Then it puts them together, just like the camera people, they put things together and they're able to create one video or one movie. So the brain takes the two images from the right eye and from the left eye and puts them together and say, it could be like that. It's not equal, but it's almost similar, but let's put them together and make what? One image, so that you don't see two things. Yes. So for different reasons, sometimes if the two images cannot be put together, sometimes the brain says, I rather look with one eye at a time and then I'll use the other eye at a later stage and look, or I rather switch off one eye completely and look with one eye. So when the other eye is not focusing, and then what does it do? It deviates and looks elsewhere. So that is what a squint is. It's the deviation of the eyes. They are not looking at the same target at the same time, because the image cannot be one. Yes, the infantile, we say infantile as in things that happen before the age of 1. It's one of the causes why the people get a squint. But there's other causes later, including strokes and and trauma to the muscles of the eye. Yeah.
Doctor,
okay.
There's so many things that we've heard before, you know, especially when it comes to squint eyes.
Okay.
Here hola rona. Here motho ke skiliboho. If no doctor nalwena, if re ka etsa matlho rona abe so. Nka bona high 2. Right? Like if nna no kwa etsa so like go ore go ba blaring yana so obviously ka myth maybe I reckon ke myth here. I'm not sure, you'll explain.
Okay.
Bare motho matlo a skiliboho how lebelletse so because litlhelelo ka re lebelletse kwa how sure hore o lebelletse wena o ka bona a bolela so a o manya and a we memo and then o mongwe memo and then o feela hore motho bolela nna mara ka metsa selo khanto o bolela le o amagala gwa o kampa maro lebelletse wena because matlo a so I want to understand gore is it a myth or ke nnete na gore he matlo a le so motho o if le o so doctor o kono o bona high 2 or high 3 or no na myth fela na. Can you please explain that one, doctor?
So as I said earlier that the brain functions and put the two images from the two eyes together.
Yeah.
If that can't happen, the brain, if you get a squint as a child, because the brain is still developing, the brain decides it learns to say that I'm going to look with one eye at a time. So in other words, the squint alternates.
Okay.
They will have a squint of one eye, then later the brain decides to use the other eye. So it alternates the eyes. But sometimes, also in kids, older kids, the brain decides, if this eye doesn't see well, and I see this is one that sees well, let me switch off this one. And that is the eye that is always squint, and then the person always sees what? One image. The people that usually see double vision because of a squint is if the squint develops later in life. Yes. Because your brain has already made his programming, it's finished, and it says, this is how I see things. And then now suddenly there's a problem that gives you a deviation of one eye, maybe to outward or inward.
Yes.
But now that's a problem because both eyes are strong and they can see quite well. Then that's when they start seeing double. Yes.
Yeah, no, guys, this topic is heavy and I believe you're also learning. But for now, when we come back, let's have the questioning salon. This is Connekt Media. I'm Sbu Ndengese. Can I let Dr. Debeila? We're talking about...
Are we talking about glaucoma or everything in the eye?
We will be la doctor. Connekt Media. Oh yeah? Welcome back, guys. This is Connekt Media, and I'm Sbu Ndengese, and I'm still chilling with the beautiful doctor here. So, doctor, today, get 12th of March.
Yes.
You know, and give World Glaucoma Day. Now, let's start here. What is glaucoma?
So, glaucoma is a optic nerve disease.
Okay.
Where the optic nerve, the one at the back of the eye, degenerates. And this is usually in association with high pressure inside the eye.
Okay.
We call it intraocular pressure. So if I say IOP during the interview, just know that I'm referring to intraocular pressure in short. And it's a silent blinding disease, unfortunately. Because
silent blinding disease.
Yes.
So
yes, you can go totally blind and it's irreversible once you are totally blind.
Okay.
And so most often when people come and they are blind from glaucoma or they start experiencing visual problems as a result of glaucoma, it's a bit late. They usually come in the later stage of the disease. Yes. And we cannot reverse the damage that has already happened. We can only protect the remaining portion of the nerve by putting you on treatment. And the first line of treatment, it's eye drops. Yeah. And the eye drop that we usually use first, if there's no contraindication or no reason that we use it, you only have to put it at night only when you go to bed. So which comes convenient. And as the doctor treats you, as the ophthalmologist doctor treats you, and they notice that eye drops are not helping or your disease is progressing. Yeah. Even when you're still on medication, and then the doctor will assess you and decide now we need to go on to the next step, and which can be laser. And if the laser, it's not helping, and then the other step, it's a surgery.
Okay.
So in actual fact, as to why do you get glaucoma and why do you get high eye pressure, it's that normally in the eye has its own water system. And in the eye, there's aqueous humor, which is the water in the inside the eye that gives the eye nutrition and cleans the eye. There's no blood inside the eye. So it's the aqueous humor, then the eye forms it for itself, and then after it has done all its work, it needs to be drained out of the eye.
Okay.
Yes. So there's a sieve that is called the trabecular meshwork. Then it goes into the canal, a canal of Schlemm, and then from there it goes into the blood vessels. So it's sort of like a plumbing a process where there's a sink with those holes that take the water out, then it goes to the pipe under the sink because before it goes to the main drain. Yes. But if there's a blockage anywhere in that draining system, then that's when you get what? High pressure. And the blockage could be that there's two types actually of glaucomas when we're speaking of the blockage. There's so-called, when we say open angle glaucoma and closed angle glaucoma. The angle where the water drains, if it's snipped closed, then we call that closed angle glaucoma. That is one, it's an emergency. And usually people will present soon with eye pain and a red eye. And then the open angle one, that is the one that is a slow blinding disease because by physically looking, the angle, it's open. So the drain looks open, but it's only when we go at the microscopic structures, we see there's problems that leads to what? The poor drainage of that system. Yes.
Okay, we'll continue with that, Dr. Ne, but I also want us to talk about this day. Why World Glaucoma Day? Why this day? Why the 12th of March?
Okay, so let me start by saying that it is not just World Glaucoma Day. The whole week it's Glaucoma Week.
Okay, the whole week.
The whole week it's Glaucoma Week.
All right.
And it is just today that is said to be the exact date for glaucoma.
It's only birthday, how
yes,
the whole
it's
month.
It's birthday week. It's Valentine month.
Hallelujah.
It's Women's Month.
Okay.
Yeah. So we just did Valentine. We just did the month of love.
Yes.
Now we are on the month of glaucoma. So it's the whole week. It's Glaucoma Week. So like I said earlier that it is a silently blinding disease. By the time you get symptoms to say that I may be having glaucoma, it's quite a bit late. You at least have probably at least 50% of the damage has happened to your nerve. And that is those people that really come early. But most often when the people that come, they usually have like 80% and more of the damage has already have happened. So hence there needs to be awareness to tell people there is this disease that exists. There is this disease that blinds you and we cannot reverse it. But should we find it early, we can treat it, we can control it, we can help you what? Stop what? It from progressing with close treatment. Yes, and management.
So, okay. So now, when is the right time for motohorem? A check away. You have to wait first to the symptoms. There's something wrong with my eye, or you must just get regular tests or checkups.
Okay. So the following people needs to get their eyes checked for glaucoma at least once a year. Okay,
before doctor. Doctor, are the following people. So the following people, I hope I'm not molesting. Okay, doctor, yes, the following people?
If you know that you've got a family history of glaucoma, if you know somebody in your family that have been diagnosed with glaucoma, and this may be hard like in the olden days where we've got a lot of our relatives, your grandmother and your grandfather, they died when they are blind and you don't know how. So you'll ask me, doctor, but how will I know? If you've got a family, they've been to an eye specialist, but they still could not be helped for their blindness. It could have been glaucoma. That's one of the commonest blinding diseases. So just get yourself checked because you are not sure if it's glaucoma. But if you've got a family history of glaucoma, definitely you know that, or you know your family has been going has been getting eye care and they told them they're not getting cured, or they've just been giving them eye treatment, eye drops, they feel like the doctors are playing and not helping, they most likely have been having glaucoma. You need to also get yourself, you need to get checked.
Okay.
If you are using steroids for any reason, whether it's on the face for your eczema, whether it's in the eyes, whether it's for inhaler for asthma, or whether it's for any treatment. Having said that, I'm saying also, please, let's not abuse steroids to build muscles or for wrong reasons where we want to like beautify ourselves and get lighter skin complexions. These are one of the risk factors of steroids use. It's that you are at risk of getting glaucoma. So don't use steroids unnecessarily.
Yes. Limit.
You should use them prescribed by the doctor.
Okay.
And even doctors, they know that if somebody needs to be on steroid for a long time, we say the so-called the steroid sparing therapy. There's other treatment that we'll use to help actually do what? Make sure that we use the steroids less.
Yeah.
Yes. So people should not abuse steroids. People should not go and be experimenting with steroids. This is one of the reasons why. But there's many other reasons like side effects like diabetes and high blood just from the use of steroids.
Yes.
And another group of people that needs to be checked for glaucoma, it's all the old age people. Because they're one of the reasons.
From which age?
From the age of 60 onwards.
Okay.
Yes. You would want to be screened for glaucoma because it's just also a chronic disease that also happens with aging. Those sieves and those pipes that brings the water out of the eye, they just get tired. Just like any other thing in the body gets tired. Like you get high blood pressure, you can also just get that high eye pressure to the glaucoma. Not necessarily because you have a family history. People with diabetes and hypertension, if you're having sleep apnea problems, you are snoring or you have sleep apnea issues, you also should also get yourself checked for glaucoma. Yes. And also to the general population, when you have an encounter with a eye health worker, this could be your optometrist, your ophthalmic nurse, or the ophthalmologist. What we do from our side is that when you come for your eye problems, we also check your optic nerves just to screen for glaucoma because we know that it's a silent blinding disease. And there's nobody that is written that has a sign on the forehead that says risk for glaucoma, risk for glaucoma. Besides those few groups, then the other ones, you may find out that you've got it and you didn't know. So when you come, don't shout at us and say, doctor, I just came for my itchy eyes. What are you doing? Busy checking my nerves? And we want to make sure, because this is a silent blinding disease, when you come to us, we take that opportunity. It's called opportunistic health promotion and opportunistic health care. So we take the opportunity and actually look at your eyes to make sure that you've got glaucoma. Because quite often, most of the people that were caught very early to be having glaucoma, they didn't come complaining for glaucoma or glaucoma-related symptoms. They came for something else. Yes.
Only to find that
they have glaucoma.
Yeah.
And having said that, we know that you are not having symptoms that time when we pick it up quite early. So it is easy also for a person to say, I just went there for an itchy eye and then she started the other stories. It's important to comply with the treatment because that is what is going to spare your vision. Yes.
All right. So guys, offer this information because today magidi 12th of March ki World Glaucoma Day. So no for fela, but the episode will be released very, very soon. In few days, the episode will be released. So make sure you look out for that. But information inyane check fela man hore flopo ilong gore ka tsona le yona ke efeng. All right, doctor, we have few questions, ne? Okay, can I let's but after these questions because maybe one of the question is whatever that I wanted to ask you about, you know, because if you look at but it's fine. Okay, question number 2, it's Tabo is in Joburg. As someone living with diabetes, I've heard that I'm at high risk for glaucoma. Can you explain the connection between diabetes and glaucoma, and what steps should I take to protect my vision?
Okay. So firstly, being a diabetic person, you need to get your eyes checked once a year, at least once a year.
Okay, once a year.
To check for diabetic retinopathy, which is the disease that affects vessels at the back of your eyes because of the diabetes itself.
Yes.
Then based on that, your ophthalmologist will tell you, I think you're controlled, then we will do our checkups every year. We'll continue with the checkups every year or every second year. Or if that ophthalmologist finds something, they will tell you later how often they have to check you based on the findings. But now, going to back to your question of the glaucoma and diabetes. So it is just being found, there's a research that has been found that people with diabetes, they are at a higher risk of glaucoma.
Okay.
And it is probably have to do with that fact that diabetes affect the blood vessels of the body. And more sensitive is the small blood vessels in the eye. That is number one. The diabetic itself, when the person now start having diabetic retinopathy, the very disease of the blood vessels.
Yes.
If it gets proliferative now, it start going more and more, then it start growing abnormal vessels that can actually encroach that ankle and close it. Or even before it closes it, it blocks it. Yes. So those are the relation of the diabetes and the eye. And another one, it's that with diabetes, the people who have diabetes also, they're at risk of getting cataracts.
What's that?
The lens getting opaque.
Oh.
Yes. Even before, we know that a lot of cataracts happen usually in the elderly people.
Okay.
But people with diabetes, they also have that risk of just getting cataracts. And because the cataract is also related to the high sugar levels. So sometimes the lens swells, which is the cataract, it swells from that high sugar. And when it swells and swells and swells, it obviously builds up, it fills the eye, and then it's going to have what? The blockage on that ankle. And then the person also get glaucoma.
Yeah, no, I hope warabehile. Okay, we also have Nomzamo is in Cape Town. Nomzamo, I have a family history of glaucoma. I think maybe let's go, but doctor. I have a family history of glaucoma, and I'm concerned about my own risk. Are there any specific warning signs or symptoms I should be watching out for? And when should I seek medical attention? I think we spoke about this, but yeah, you can.
Yes. Nomzamo, get your eyes screened, see an ophthalmologist or see an optometrist who will do your fundoscopy at least once a year. We don't want to wait for symptoms, because by the time we've got symptoms, we've got at least 50% of the damage. And usually it is at 80% or so. People that come with symptoms that I've seen, they usually have 80% or so of the damage, and it's not reversible. So rather get yourself checked out every year.
All right, we also have Bongani. Bongani is in Durban, RN. I've recently turned 40 and heard that age is a risk factor for glaucoma. Should I be getting regular eye exams even if I haven't noticed any vision problems? I think it also goes back to Debeila every year. Every year. It goes back to that, right? Okay, we also have Lerato in Pretoria, RM. Okay. Yeah, this one is interesting. I'm pregnant and experiencing blurry vision. Could pregnancy hormones be affecting my eyes? And should I be worried about developing glaucoma during pregnancy?
It's a different one. Yes, pregnancy, it's known to change the shape of the eye slightly, and people get blurry vision. But please just make sure that, I'm not an obstetrician, but please make sure that you have been checked by your obstetrician or your health worker at the clinic to make sure that you don't have high blood pressure or high sugar, because there is so-called pregnancy-induced diabetes and pregnancy-induced high blood pressure. Those are the things that can lead to like significant blurry vision that time. And those are like life-threatening issues that needs to be attended to by the relevant specialists, not me.
Yeah.
But a mild blurring of vision, it's being recorded in pregnancy because there's just a slight change of shape of the eye, just as the whole dynamics of the body changes with pregnancy. Yes.
Okay, let me see. We also have Point Port Elizabeth. I work outdoors and I'm exposed to a lot of sunlight. How does UV exposure contribute to the development of glaucoma, and what measures can I take to protect my eyes?
I'm not aware of relation to UV exposure and glaucoma as a risk factor.
Yeah.
But UV exposure does have damage to your eyes in other ways, that you can get conditions like a pterygium, which is an overgrowth of that conjunctiva that we spoke of. But it comes with like a fibrovascular tissue, which is almost like sort of a scar tissue that goes onto the cornea. Then it starts affecting the vision of your eye. Another way also sun exposure affects your eyes is that now your risk of developing cataracts get more closer than the other ones that it happens at an older age. So if you can wear sunglasses when you're outdoors, all of us, we should be wearing sunglasses when you're outdoors to reduce exposure to UV for those reasons. And worst case scenario, it's when, especially if you can look at the sun directly for a long time, you can get what we call a solar retinopathy, where you get damage to the retina, the back sensors of light, photosensors of light, they can get damaged from sunlight. But he must wear sunglasses outdoors.
Yeah, no, ko mmereko ba mi reletsela tsa bona tsa ko mmereko because batla re yo wa ipona o bereka ka stina mo apere di sunglasses.
Yes, protective eyewear, very important.
Yes. We also have Ntombin Bloemfontein, RN. I've been diagnosed with high eye pressure, but haven't experienced any vision changes. Is high eye pressure always a sign of glaucoma, or could it be caused by other factors?
Yes. So if we're talking it from like the textbook point of view, there's high eye pressure, which is ocular hypertension without glaucoma. But in most of the time, high eye pressure causes glaucoma. It's almost always causes glaucoma. So most likely she got diagnosed with glaucoma.
Yes.
And they just with high pressure. So glaucoma, it's almost always related with high pressure. So that's what we're treating. When we give you medication, we're lowering the eye pressure. So if they actually find that there's got a high pressure and doesn't have symptoms, she must say, hallelujah, thank God, I'm lucky, I'm blessed. Continue taking your medication, and there's no cure for glaucoma. Yes. Don't stop. Even if you're relocating or you're going elsewhere, ask your doctor to give you a summary of your findings and how you've been doing, and ask your doctor to refer you to another ophthalmologist where you are going to stay. Don't stay, no, I was in Joburg, now I've moved to Eastern Cape, that's when I stopped the medication. Then the damage happens. So there's no cure for glaucoma. People need to be on medication all the time.
All right, we also have another question from Jabulan in Soweto. I've been prescribed eye drops for glaucoma, but I'm concerned about the potential side effects. How common are side effects from glaucoma medication, and what should I do if I experience them?
Please say that again. How old is the person that asked?
I'm not sure about the age.
No problem.
Yeah. Must I repeat again?
No. I got the question.
You got the question. The age. Yeah, I'm not sure about.
They said about the age. So there's no medication without side effects.
Yes.
Let's just start there.
Yes.
Even Panado. Yes. The Panado that we use every day, there's no medication that is without side effects. When it comes to the glaucoma medication, the one that we use, that we say that they are prostaglandin analogs.
Yes.
The first line, if you listening, it may have been the Lumigan, the I think I'm not allowed to mention names, ne? Because it's advertising a specific companies. The one that you take at night. That's what I'm supposed to say.
Okay.
That one that you take at night only. Yes.
Yeah.
The side effect is that they get red eyes, and I say this one side effect is something that ladies will love. They get also long lashes.
Oh.
Yes. And then they get hyperpigmentation of the skin around the eyes, and just normally like the volume of the orbit also, the fat around it gets less. So those are the common side effects of the prostaglandin analog, which is those eye drops that you put only at night. Yes. And the other ones also, it's when you go to the beta blockers, it's also then your doctor will tell you, we will ask you if you've got asthma, because there could be an exacerbation of your asthma, and if you have asthma and you have to use it, but then the doctor will choose the right medication for you.
Okay.
And in general, eye drops are preserved.
Okay.
Yes. So the preservatives are the one actually that have toxic effect on the eye.
Yeah.
Yes, in the long run. But in everything that we do, we always consider benefits versus the risk.
Oh, yes.
So you cannot stop your medication saying that I'm worried I will have side effects. The doctor has checked that before they put you on the medication.
Yeah.
Yes. So, and then you rather discuss that with your doctor if you're having unbearable side effects with your doctor, instead of just stopping the medication on your own.
So consult, yes. All right, we also have Zanele in East London. I've heard that smoking can increase the risk of glaucoma. How does smoking affect eye health? And if I quit smoking, can it lower my risk of developing glaucoma?
Definitely yes.
Okay.
Definitely yes. Remember the smoking?
Yes.
The effect of one effect of smoking is that it works on the blood vessels.
Oh, yes.
It damages the blood vessels. It thins the blood vessels. It just doesn't damage your lungs, as in the direct damage on the lung, on the lung, it's definitely related to the smoke. But the very effect that makes you feel good also when you're smoking.
Yes.
There is also a damage to the blood vessels. Yes. And also, in terms of how does the smoking damage the eyes, you can see that firstly that conjunctiva, that skin, it changes color. It goes brown when you're smoking.
Okay.
Also, that risk of getting cataracts, it is more. And yes, smoking, because it affects what? Perfusion, as in blood supply.
Okay.
To the nerve. Then it also there's definitely put you at the risk of getting glaucoma.
All right.
Anything that affects the blood supply to the eye, it's also a risk of you getting glaucoma. Yes.
Okay. We also have Paul and Kimberly. But my father has glaucoma, and I'm worried about my own risk. I think we spoke about this, but yeah, you'll just answer again. I'm worried about my own risk. Is glaucoma hereditary? I think you spoke about this. Yes.
And this is also being identified at gene levels, that there's genes that are associated with glaucoma. So definitely yes. Okay.
So what do I do to lower the risk or detect it early?
Gets in by an eye specialist every year.
It goes back to that yearly thing.
Yes, yearly thing. And then if you can manage the other risk, we in everything in health, we speak about modifiable risk factors and non-modifiable risk factors.
Yes.
The fact that you've got the family history of glaucoma, you can't do anything. You cannot change your father.
Change it, yes.
You can't change your father and say, let me change my genes. We're not at that stage. Remember that gene therapy is still in the experimental stages. Until we get to the point where we can help human beings at gene level, we unfortunately cannot do anything about that. But the rest of the other modifiable factors, she can manage. Yes, she can do everything to eat well and exercise to avoid getting diabetes and high blood and not smoke. And manage the weight as well. As I said, that people that also are snoring and having sleep apneas are at risk. So we know also all those things are associated with having a higher BMI.
Okay. Last question, Lungile in Pietermaritzburg. I'm experiencing frequent headaches and eye pain. Could these symptoms be related to glaucoma? And when should I see an eye doctor or further evaluation? But I think it goes back to that yearly thing again. So most of these questions, Debeila go
yearly, yes.
Yes.
And definitely eye pain and headache is one of the symptoms for glaucoma.
Okay.
Yes. It's not the only thing that will give you eye pain.
Yeah.
But this is one of the reasons why you get eye pains. It's
Okay.
glaucoma.
So now, Dr. Ke sunglasses all the time. Because hexabara di sunglasses matlo ka ba botlhoko and then atswa dikeledi and ka motlase ka mo a ruruha. So now, go what's a song? Do you think ke na le flopo ya matlo? And when I read, he ke bala henka bala sebaka. Atswa dikeledi. So do you think ke na le flopo ya matlo?
Yes, you do. I'm not a prophet, I'm joking.
No matter all
But
right.
I'm just giving you the common the symptoms that you just relate.
Yes.
You're relaying the symptoms of dry eye disease. So when the eyes are dry, they don't want exposure to air, wind, anything, and then they pain. And I know it doesn't make sense that why my eyes are tearing when they are actually dry.
Dry, yes. That's what
What's your story?
I wanted to ask. Yes,
What
it doesn't make sense.
Saying? What are you even saying?
Yes.
It's a reflex of saying then, if I don't have enough tears, then let me just pump more and bring them out.
Oh.
Yes, one. And also the second reason why you also tear is that tearing, it's not, remember there's tears that are produced even like now when we're sitting here.
Yes.
But they're not flowing because it's not a reflex and overflow.
Oh, yes.
It's just a balanced formation of what? Production of the tears. That is why they are not overflowing.
Yes.
But other reasons why your tears, they overflow is when there's what? There's an irritation. When the eye is dry, it's like when the skin is dry, it can irritate. Then what? It produces what? Lots of tears. And then it's like, why didn't it produce the tears anyway that time when I needed it?
Yeah.
Because remember, for you, when tears come out, you see just water.
Oh, yes.
But when we look at tears under the microscope, there is water,
Yeah.
there's a mucus layer, and then there's oil. Yes.
So,
Yes. So, but remember the main one, it's that the bottom one, the water is the one that keeps your eye wet. And then the other two, they are to keep what? The tear film, what we call the tear film, stable to keep your eye lubricated. So all these things work together. If there's a problem in any of this component, then you're having dry eye issues. Yes.
That's for like a setho. I do monate mara. Kirka setho. I do monate. But get the muy huta doctor hore. Lebo matlong. Lucas. Wow.
Yes.
Yeah, no, it's true. We learn every day. And doctor, we have this problem as a society. And I think, but what man, but to they're not even professional comedians. But professional comedians, you know, making fun of the condition it's about. You know, we have, but to buy long now, they don't want to go and see doctors yet on a problem. But to suggest you know, and now growing up, remember this thing at school, especially primary, middle school, how with 4 eyes. But you are blind. Let's doctor, because doctor I used to love this group. And I agree used to because I was together. This I agree used to rhythmic elements. They released this beautiful song along as a whole, you know. There was a part that I didn't like more that song. Erin Abutiwe Klobola di glass, otherwise re tlo di tuba. So motho o elong hore ona le problem ya matlo ha le ko monateng a ikutlweletse a tshitse ka paretse di brele tsa hae tsa matlo a sena problem go tlhahella that part Dr. A. So what I'm trying to say now to you Dr. go hore re na le batho ba elong hore obviously they do this and bona ono yetsa nje a joke fela you know but ha aware hore e etsa impact e bya mo mothong o mong etsa o ba le low self esteem o thoma tlhakatlhakana gore ha feel hore ha tswa apparently so o feel hore e re ke fihle because they will make fun of me but ba re ke for eyes especially di breletsela tsa bona tsa lentsela tse kima tsela
fake lenses.
I understand so I think maybe since you are here and you are a doctor just can you just motivate someone especially le ena o elong hore dilo tse di etsahala mo yena I understand because ke ena le more that condition the person who's doing that more conditioning ill you know maybe if advising yana a few seconds doctor to batho ba ntseng yalo what can you say to them
okay. Well, I didn't even know that it's offensive in that song. I just thought it meant I thought it meant put your eyeglasses down because we're gonna get down now, hey? I thought, and for some reason, it just felt like the person in that song is probably wearing sunglasses and.
Yo, doctor, it becomes a problem, you know, and it's funny because not so long ago, we had a closing function at work, and we went somewhere, and there's this lady so she's always wearing those glasses. I think maybe she's taking them off. How no kwale. After a few drinks, doctor, I'm surprised. I was like, Emanyana, what's up? So the drinks I said so I failed to understand that. But anyway, yeah, it's fine. But yeah, a bit of advice to buy long horba situation or buy long horba.
Yes, so it comes to inside issue. People understanding what's happening with them.
Yeah.
So I must say that spectacles is more towards optometry.
Yes.
So it's important to speak to your health worker first and understand your needs and why you have to be using a specific treatment. And in this case, we're talking about spectacles. So stigmatizing things happen in a lot of things, especially for a lot of health conditions. And wearing spectacles it's definitely one of them.
Yeah.
But I think more for the person that is being ridiculed, be strong and most importantly, you understand why you need to wear spectacles. But I also have a set of also good news for the people that are wearing spectacles. If you don't want to wear spectacles and you need to wear spectacles, there is refractive surgery where we do laser treatment on your eyes. And we change the shape of your cornea or the shape of the front part of your cornea. And there's also more other procedures besides laser refractive surgery. There's a lot of options that we have in terms of refractive surgery for people that don't want to wear spectacles. The option is also available.
How dangerous is it safe?
It is like a very minimally invasive procedure.
Do you use needles?
No.
Okay, no, doctor, I will do that. No, I will do that because and then so now I can go for my checkups those glasses because I know you have those ones stay long when you indoors when you outdoors the sunglasses, you know. So if you're eating your then no, doctor, as long as it's not injection. The last one and then we close, we're done. We have people by long kare ba bereka ka di grainara ba bereka ka dilo tsela tsa o tlhakantsha di chip kana le re ke dilo mang tsona tseo so okay you know batho ba na tlhaloganyo tsa bona man and we understand no nna matlhoka strong it doesn't affect them too because you know what they have to wear those glasses. So I think maybe you know about this, maybe you can tell them how dangerous it is because we're here to help them so that they be educated by it or once you do this, o te kenya mo risking o ka feletsa o stlhole o bona kgotsa o loser litlo o matlo.
Definitely. So protective eyewear, it's very important.
Yes.
Especially for the people that are dealing with welding and grinding. And we see them quite often where there's they come in, the foreign body is stuck on the cornea, which is the front part of the eye, and then we have to take it out. And some people, you'll find out it's they still don't learn. They go back and it happens. And then you've got a lot of scars on the cornea, and we want the cornea to remain clear. When it scars, then it gets to a point when it does not see. You cannot see because it's scarred. And the only way for us to help you with that is for you to get a corneal transplant. And the transplant is just like any other transplant. There's waiting list. There's scarcity of tissue because nobody wants to donate their tissues. Just like there's a waiting list for heart transplant and kidney transplant. It's the same thing with the eyes. And worst case scenario, it's that spark can pass actually on the cornea. It can perforate and go into the eye. And now you need a major surgery in the eye because you've got what? A foreign body inside your eye. Yes. Small as it is, that is a bullet because whatever you are doing there, it's high velocity work. So when it injures the eye in the same high velocity as a gun would shoot. Yes. So protective eyewear, it's very, very, very important. Yes.
Okay, doctor, thank you so much. I learned a lot, all the time when I come here, I go home with something new, and today I learned 1, 2, 3, 4. And I hope and believe that our viewers also learned a lot today, so what they check bila so that they know how to avoid certain things or I didn't know every year so today at least I know, So your last words to our viewers, and also where do they get you on social media? If they want to know more, if they need help with whatever we're talking about, how do they get you? Are you on social media? Do you give out numbers? So yeah, that whole information.
Okay. We are on Facebook, and our Facebook is Dr. Debeila Eye Care. You just search for Dr. Debeila Eye Care on Facebook, and our website is www.drdebeilaeyecare.co.za. And for consultation and booking, we work by appointments at Botshilu Private Hospital. The telephone number is 012-798-7038. And also we've got a WhatsApp line. What's my WhatsApp number?
No, you don't have to give out your WhatsApp number. Hey.
It's on the website, definitely.
Oh,
it's
okay.
Definitely on the website.
They will get it on the website, yes.
If you go on the website, you'll find our WhatsApp number. And yes, we will take your questions and queries about your appointment there.
Yes.
And yeah, we emphasize, like as I said earlier, that I'm an eye surgeon. When you have a surgeon, it means at some point they have to go to theater. So avoid walking in. If you come in and we're there, we will help you. But please make appointments because at some point, if the doctor is in theater, then the doctor won't come. To avoid disappointment, please make appointments. And please, with the glaucoma, get your eyes checked at least once a year. Because glaucoma is a silent blinding disease. And take an opportunity and please get yourself screened this week while it's still glaucoma month. Thank you.
All right, no, doctor, thank you so much. And I think from today, it's official.
Okay.
So it's official, Horo, you are my doctor. Because I've had this problem for so many years, but I consult. So, Horo, doctor work.
I'm waiting.
And then because with this new relationship, doctor,
I'm waiting for you.
What's your medical, doctor?
Yes.
All right. Guys, thank you so much for watching this episode, and I believe you learned a lot. Bona, we are here to make sure information and manso I long abuima a difficult I long doctor Power Berekis. Let na antlaba. Google and go hide. That is why I always say have your diary with you, or a pen and a piece of paper, or more phone. If it means record, it's fine. But you can Google or check it so that you understand. And important for you to understand. Make sure really Google. Thank you so much for watching. Wait for another episode. We're not done. We're coming back again. This is Connekt Media. My name is Sbu Ndengese. Our company happen next time. Oh yeah.